Welcome back, ladies and gentlemen, after a little relaxing week off to the Excellence Cartel. Today, we're joined by one of our regulars, Dr. Sean Golden, and today we are going to be talking about all things inflammatory bowel disease, IBD, IBS, all that good stuff. We're going to go down a rabbit hole. But before we begin, Jason, how's your last 7 days been, man?
Man, it's been really good. Just kind of, taking my time to enjoy life, but also get work done, and been a good balance. So I really can't complain. Some big meetings coming up for the HRT clinic. There may be a new partnership coming on. I don't want to divulge yet, but it could be big, and it'll really propel us further much faster. So I'm really excited about that. That's not happening until Friday. My damn car ended up with a flat tire, so I got to take it into the shop tomorrow. And that's just a pain in the ass, man. Like, it's just shit out of my day I really don't need to do, but it is what it is. So other than that, though, man, it's 68 here. It's sunny. It's freaking March, and I'm ready to just have a good spring, man.
Nice. Is it the Porsche that got the flat?
Nope, it's the Mercedes.
Oh, that's even worse.
Now I'm driving the Porsche, but the damn Porsche needs its service. So I haven't gotten that. So now I'm putting miles on it So
that's how it always goes. Oh, yeah. Exactly. Jeffrey Sue, how's your last 7 days been, good sir?
It's been a very, very eventful week, I would say. On the client side, everything's been steady, but just more things with the business. So I wanted to say thank you to everyone who bought a class from me. I think in a week, I sold 162 recordings, which was really cool. I also, to thank everyone, I hosted a business workshop this past Sunday. I might keep doing them for free. So next one will probably be end of June. Let's see, I got a couple classes coming up. I have a systems class that I taught once that was packed. I'm going to teach it again in April, working on a gut health class, probably end of this year. We'll teach that. And then what else? Oh, I started training again since my surgery. I did a very, very light upper body workout the other day, which was good. And I'm officially linking up with Jose Raymond, the Boston Mass. That's what his nickname is. Boston Mass. And I'm gonna train with him and see what he can do with my physique in the off season, and see if I want to do another contest prep, depending on the progress I make. But that's about it. Things are good. I tried to make the most out of my downtime. I'm someone who I just can't sit around and do nothing. So I did a lot of stuff. So
good for you, man. That's sometimes the best way to, keep yourself occupied and out of trouble. It's always good. Sean, how's your last 7 days been? I'll go with mine, say a few things, and we'll get into our topic.
Yeah, my last week has been good. I liked the Instagram live we just did yesterday. That was awesome. Mm-hmm. So thanks again for that.
Dude, that was good. We had a lot of good feedback, a lot of messages I got on that one. So it's cool.
Awesome. Yeah, I loved it. And actually this past weekend, I just started getting some initial results and reviews from my online course that have been really, really good. So that made me feel great, because I love what they're achieving with that. So so far so good.
Nice. Sweet. Oh man, let's see. My last, I guess it's been like 2 weeks, I'll go with 7 days. It's been really, really good. I took a few days off. Someone who I really, really, really like came in town to spend some time with me. It was a great weekend, really unplugged. It went super amazing. Can't say enough. So that was a highlight for me for the last few days. And then now it's back to rolling my sleeves up today and getting into Iron House 2, which I will do. And I've begun looking at property to go ahead and start doing it. And I think I might shift over to leasing, but we'll see. Meet with the bank next week. And then I got some cool shit coming out, man. It'll be formally announced, but I promoted Thera to chief operating officer of Iron House. And we officially created out a general manager position to promote one of our own in, who's been with us for over 3 years. So that was super cool to create our first salary position officially underneath the company umbrella. And it's awesome that it's 2 women that I was able to, we were able to build that file for with Thera and Katie. So all good stuff. And then guys, let's get to our topic. So, Sean, let's quickly kind of go over what IBD is, and I guess what the best thing would be. How the hell did you get involved in this at the level you have?
Yeah. So first off, we need to make sure that people actually know what we're talking about here with IBD, because
Sure.
IBD is not IBS. They are completely different, and you don't want to treat them the same way at all. They have completely different therapies, different things are effective for each. So IBS is inflammatory bowel syndrome, which is essentially a collective grouping of symptoms. When you go into a doctor's office, if you have certain symptoms, they kind of check it off a list. If you match enough of them, they'll diagnose you with IBS. In that way, it's not very specific. Some people can even call it like a garbage can diagnosis. It's just there's a lot of different causes. You can have, bacterial overgrowth in the small intestine or stomach. You could have just a disrupted microbiome. You could have food sensitivities. There's so many different causes or potential things that are making that person's belly difficult to handle. Now, IBD is different. IBD is kind of an umbrella term for two autoimmune conditions, Crohn's disease and ulcerative colitis. So the major difference between IBD and IBS is that the cause of IBD at its core is that it's a dysfunctional immune system. They're both autoimmune conditions. They have somewhat different presentations, but the treatments and what works for both of those, Crohn's and ulcerative colitis, are very similar with only minor differences. And so though they're very similar, Crohn's and ulcerative colitis, is just that the presentation is a little different and what it affects. So for this podcast interview and what my course is on, it's specific to IBD. That means those with ulcerative colitis and Crohn's disease. And the reason that I did that is because there's a whopping ton of information out there already for IBS. And a lot of times, if you know what you're doing or you're getting involved with someone who knows what they're doing, usually you can have pretty good resolution to that, or you can get it under control. For IBD, usually the prognosis is pretty poor. People are, have major anxiety. They can go under depression. A lot of times surgery is needed if it progresses where the parts of their colon or intestines are removed. I mean, if you just go on YouTube and look at these people that are talking about their story with Crohn's and ulcerative colitis, it's just heartbreaking. So it's a major, major issue in people's lives. And most people with this condition, they don't know who to turn to or what resource to trust. So that's why I started focusing in it. And how I got involved in the first place was because one of my best friends when I was back in chiropractic college was diagnosed with both Crohn's and ulcerative colitis. And he had already lost 20 pounds. He was running to the bathroom like 30 times a day, not because he had to use the bathroom, but because of dripping blood, to be honest. And he was kind of freaked out and scared for his life. He didn't know how he was going to be a chiropractor with this condition. His future was not looking good. He was already on a biologic, Humira, that didn't do anything for him. So that even made him freak out more. By the time I kind of got involved with him, he was about to go see a naturopath who was going to put him on a very, very strict and long-term elimination diet that would have been very limiting. And I told him, hey, I'd already overcome my chronic health issue, my hypothyroidism, when nobody told me I was going to be able to. So let me just see what I can do for you. So I kind of put my research kung fu skills to the test. And over like a 4 or 5 month period, I just dug through the research, looked at clinical trials every day, and just pieced together what showed that it worked. And we put together a little supplement and nutrition protocol for him. And within a month, he was luckily in remission. And that was over 7 years ago at this point. And he's had like 1 or 2 very minor flare-ups, like a week. And it was, during the whole time, he's actually got off the diet, off the supplements, and he's been able to stay in remission besides those minor episodes. So that's what made me kind of want to dive into this deeper, thinking that I might have found something. And so I really spent the next 5 years or so working with people one-on-one and kind of refining this process until I was able to get it into an online course.
Sweet. Now I do have a question. Now I want to pass it to them before we go to the next part. What are your thoughts on biologics? Sorry, like Humira. Got tongue tied there. I just got done eating.
Yeah, so I'm not going to say they're not necessary at sometimes, because they might be. However, I don't think it should be the first approach that it usually is. And so a lot of times, if you go to a medical doctor, you have Crohn's, if steroids fail you, which most often they do, then their next option is a biologic. And at this point, they haven't talked about diet, they haven't talked about lifestyle, they haven't talked about stress, obviously not supplements and stuff like that. And so when you go on a biologic, there's a host of side effects that not only potentially come with that, but most often do come with that. And one of the severe ones is a biologic induced arthritis or lupus, even, which is actually relatively common for those who take it for Crohn's and ulcerative colitis, where you get widespread joint pain, where you sometimes it's hard to get out of bed and live a daily life, among other symptoms like an increased risk of cancer and stuff like that down the road. So I don't think it should be the first step, especially when there are so many clinical trials available that most people just don't know about that show effectiveness for much, much safer options. So I think that the safe option should be exhausted first, and then things like a biologic or surgery would be down the road, which is what we do for everything else. If someone has a rotator cuff issue, surgery should not be before PT, for example.
Yeah.
There should be a chain of events where you go from safer things to things with potentially long lasting and severe side effects. So that's my take on it.
Sweet. Sue, Jason, you guys have anything you want to chime in there?
Yeah, I mean, well, I have a question, or just want to, I guess, tell a story and see what Sean thinks.
I like
so I
stories.
had a mentee that basically had, was diagnosed with Crohn's disease. We ran her GI map, and she had H. pylori, candidas, bacteria. Is that common with Crohn's, or do you think she was just misdiagnosed? Because now we're trying to kill off those bad bacteria, and she has seen benefits and improvements. So I'm wondering, like, if that caused the inflammation that then caused more of the Crohn's type diagnosis. But that's what I'm seeing. Have you seen that? Did you guys run a GI map with your guy or anything else? And that's just kind of my curiosity.
Yeah. So what I say in my course is really there's three big pillars when it comes to Crohn's and ulcerative colitis. There is dysfunctional immune system, there's chronic inflammation, and there's a disrupted microbiome. So you're kind of talking about that last point right there.
Got it.
And they all interact with each other. They're not like three standalone pillars. A disrupted microbiome is going to affect the immune system and vice versa and things like that. And so, of course, you want to, if you have options that can treat the microbiome or get rid of yeast species and stuff like that, that's always going to be beneficial. From my experience, that usually isn't 100% enough to completely kind of overcome the condition or really get to the root of the issue. The major problem that I see with trying to attack the microbiome is we tend to try to fix the microbiome only with things like probiotics or antibiotics or like other bacterial species or stuff like that. When that's not the only thing that interacts with the microbiome. For example, when you eat a food like beans, for example, people think it's just the fiber that impacts the microbiome, but beans come with a host of polyphenols as well that directly kind of synergize with the fiber and influence the microbiome. So that's just one aspect. On the other side of things, if you're deficient in certain nutrients like vitamin D, vitamin A, vitamin D, its active form, calcitriol, another name for that is antimicrobial peptide, which goes to show how important like vitamin D is, as an example, at regulating which type of species can survive in our gut. Our body should be able to kind of fight off these pathogenic species themselves. It shouldn't be something that we're always trying to do exogenously through antibiotics or probiotics or something like that. Those can be helpful, But at the same time, for example, what I've seen with medical doctors is they'll overdo antibiotics, which will tend to help short term, but long term, 6 months, a year later, the problems just start up again, and then it's actually harder to fix it the second time around. So it just depends on what angle you're kind of coming at it from, and to understand that the disrupted microbiome isn't the only extent of the issue.
Yeah.
My concern is that they have her on an immunosuppressant drug. And I know those pillars that you're talking about. And I told her, I was like, we got to get your immune system healthy. So I have her on, like, colostrum and our immunoglobulins with my accompanying bloaties and obviously other things going on. But I'm like, we're just counteracting it. So I got to get that med out, but I've been kind of waiting to pull it until we had inflammation down. But tricky stuff, man. It's interesting. So yeah, anyways, I appreciate it. But
yeah, it's difficult when someone sometimes is already on a biologic like that. What I usually do is I never want to pull someone off a biologic when they already have a lot of symptoms, because that's not going to go well. It's going to flare up like crazy.
100%.
It's very similar. I kind of explain it this way. It's very similar to stress, to be honest, because when you're under chronic stress, you obviously release this cortisol, stuff like that, which is the same thing as someone giving you prednisone as a way to treat the condition. A lot of times people with IBD, when they're in a very stressful period, especially if it was sudden, their symptoms can actually decrease. And they don't put the pieces together until afterwards, when the stress actually dies down, and then a flare-up starts. And what was happening was the cortisol that they were releasing was decreasing inflammation, which is what it does, but it also decreases healing responses, which is why, chronic cortisol can give you ulcers in your stomach. You need tissue turnover in the gastric tissue every 7 days. And so if you are under chronic stress, you are decreasing inflammation, but you're also decreasing healing. So when that cortisol finally lowers, all of that inflammation is going to rise to the surface that was suppressed, and you're going to get in a huge flare up. So if someone's been on a biologic, taking them off will almost inevitably raise symptoms, even if you're doing everything right. And so you'll have to work obviously with the medical doctor, figure out what the right approach is for this medication if they want to wean off of it. Sometimes it does need to be a gradual approach rather than a sudden approach. And having all of the right factors in place to help their body deal with that is very important. Right.
And that's where we're kind of at right now, getting everything taken care of. So yeah, no, I appreciate the input. That's helpful. So everyone listening, that does answer the question. There is a microbiome component to IBD and the diagnoses under it. So thanks. Appreciate it, Sean.
Yeah, no worries.
Back to you, sir.
No, Jeffrey Sue's got one before we move on to a little bit more about fiber. I want to break that down deeper.
Yeah, I just wanted to say that, I'm someone who is on Remicade for psoriasis, and I have been for 3 years, and I'm lucky that I don't have any side effects from it. I'm also on methotrexate, which you might be familiar with, Sean. I get an injection, the highest dose that they can give once a month, and obviously that's very hepatotoxic. But luckily my ALT, AST, GGT, all that stuff is fine. I seem to react fine with it. And you're right. The doctors over the years, when I was diagnosed with psoriasis, when I was 17, they did set me up through the creams, the ointments, right? And then I advanced into like Stelara, Humira, and I had to fail all those to finally get to the infusions with Remicade. So that has been helpful. But when you were talking about, that was one thing that I wanted to kind of piggyback on what you said. But for people listening, when you said that, people focus too much on the exogenous stuff with the antimicrobials and treating, people don't focus as much on the commensal normal bacteria. And those bacteria, I think there's like 10 or 11 of them, that they actually play like very specific roles in like inflammatory signaling and like cytokine responses and modulating the immune system. So, they're and the role of fiber, for example, plays a role in helping the production of short chain fatty acids like butyrate. And that's a fuel for colonocytes. So a lot of that stuff, if not done first, and you start treating things, you're kind of missing the root problem. Because if you have a very healthy, functional commensal bacteria or phyla, you will have a reduction in symptoms, and you don't have to try to mitigate things from an exogenous perspective.
Throw
Yeah,
us a nugget. How do you go about that?
Well, I mean, there's dietary components, so there's certain
Sure.
foods and fibers. So, for example, like apples, bananas, nuts, seeds. Well, you want to avoid those if they have diverticulitis. But certain foods will help feed the good bacteria, the fiber that they need to create short chain fatty acids, and then that helps, strengthen the mucosal layer, and that will reduce intestinal permeability, and that will reduce the inflammatory cytokine response that happens subsequently from that.
Got it. Cool.
I completely agree with all of that. I mean, with the butyrate thing, it besides even acting as a fuel, it directly impacts the immune system. It increases something called T regulatory cells in the gut, which is a great type of immune system cell to increase. And this is why I actually don't like to think of Crohn's and ulcerative colitis or other autoimmune conditions as an overactive immune system. It's more of a dysfunctional immune system, because there's certain components of the immune system that you actually want to elevate and increase, and something like a steroid will actually decrease that, which is why it doesn't work long term. But something like butyrate, it increases the T regulatory cells, which is the one type of immune cell that tells the body not to attack itself and to gain immunotolerance to things, which is very important with autoimmune conditions. So I completely agree. With IBD, though, you do have to be careful with fibers, because stuff like nuts and seeds, because of the types of fiber, like almonds, for example, out of a nut, almonds is mostly insoluble fiber. Now, almonds are great for the gut, though, because they have other components besides the fiber that influence our microbiome. But for someone with IBD, that insoluble fiber is actually going to flare them up. So unless they're already in a really good place, that's definitely something that I would tell them to avoid in the beginning, for sure. So with the gut conditions like IBD, we just have to be specific to know we're giving safe fibers, rather than potentially not harmful fibers, but for this population, fibers that are not going to go well
at that time. Yeah, I guess you'll probably get into this later on, but I'm curious what you think about butyrate supplementation, or the use of like ghee and grass-fed butter to obtain it, and maybe phasing that in while fiber has to be limited to like 10 to 15 grams, for example, as upper limit for IBD patients.
Yeah, so for IBD, I do not recommend the ghee and butter thing, mainly because the amount of butyrate that's actually in butter is relatively small, to be honest. And it's obviously mainly saturated fat. Now, I'm not against saturated fat at all, but for this population, fats are tricky, because fats are the only macronutrient that gets absorbed in the colon. Proteins and carbs get absorbed in the small intestine. Fats have to get mixed with bile and go all the way to the colon. So if you have colon inflammation, you have to be careful with what type of fats you're consuming. And the research is very clear that long chain saturated fats, like those found in butter, cause potentially more of a flare up than do anything beneficial. So I wouldn't use that as a strategy to get butyrate in. Taking butyrate as a supplement can be possibly advantageous. However, taking it by mouth, you're typically going to absorb most of it before it reaches the colon, or at least in the proximal colon, like the ileum is where most of it's going to get absorbed, like the distal small intestine, proximal colon. For something like ulcerative colitis or Crohn's, usually it's more at the later parts, like towards the rectum, but not always. But in either case, if someone wants to do the butyrate strategy, to be quite honest, the most effective form is going to be as an enema by far. Because you'll get it directly delivered to where it needs to go, and it can have the most beneficial effects there, and there's no downside to that. So that would be my preferred way.
Dude, you just like shot down like the next 3 points, but let's break it back because I want to pull it. So you did talk about fat, so let's pull back to fiber though. Fiber sometimes, like you wrote, because we have an outline. Fiber sometimes can be confusing for IBD. So what would you advise someone on their IBD fiber intake, and what would you say for limits and minimums and things like that? And then let's go ahead and break it down a little bit more, because I know you did talk about like introducing fiber, so forth. What's the process for that? What are the ones that maybe you're recommending that you'd like to see? And then we'll circle back to the fats and solve that one out before we move on.
Yeah, so with fiber, there's two very important points that kind of cover everything you need to know about it. The first is the timing is very important for IBD. And that means if you're in a flare-up, you want to lower your overall fiber intake. If you are getting out of a flare-up or heading towards remission, or your symptoms are decreasing, you purposely want to start increasing your fiber intake. And this point is important because on one hand, if you do it backwards, if you're in a flare-up and you think fiber is good for your guts, you're going to consume more of it. That can actually make that flare-up last longer. So that's one reason why this point is important. The second is, when you have IBD, a lot of times you're just scared out of your mind. You're scared about eating anything because you're worried about things flaring you up, especially if you've been bleeding like crazy, you've been in a 10 out of 10 pain, you are scared. And so what happens with that fear is that as people get out of a flare-up and they go towards reduced symptoms, they don't change their diet. They try to stay at the diet that they think is safe, which is the diet that they were consuming during their flare-up. But that is very short-term thinking, and that won't help them stop the vicious cycle of it continuing. You need to improve your microbiome over time. And so as you get out of that flare-up, you actually want to purposely start consuming more fiber. Now, the type of fiber is very important. I group fiber in two main categories. There are soluble and fermentable fibers, and I'm just going to group those together, even though that's not 100% accurate. And there's insoluble and non-fermentable fibers. So the main point is if it's fermentable or not. That means, can the gut bacteria actually use this fiber for energy? If it's non-fermentable, that means you can't use it for energy, and your gut bacteria can't use it for energy. It goes right through you. That those non-fermentable fibers are known, this is decades of research at this point, repeatedly shows that induces a flare-up. So we want to avoid non-fermentable fibers or insoluble fibers. To give you an example of what that would be, it would be like a stem-like vegetables. So very hard vegetables like broccoli stems, things like that, especially raw. It would be the absolute, if you tell someone who has Crohn's to go on a raw vegetable diet, you are doing them the worst disservice you could possibly do. So the
light them up.
Yes. What gives that broccoli stem its structure, its structural integrity, is a fiber called cellulose, which is non-fermentable and does not improve your microbiome. And for someone with Crohn's or colon inflammation, it's going to induce a lot of issues. It's going to be the worst if they are in a flare-up. If they've been in remission for a long time, of course you can start playing around with that and introducing it and see how they respond. It's not going to be detrimental. But if they're in a bad place, that's definitely something you want to avoid. It's not going to have any benefits. Now, on the other end of the spectrum are the fermentable fibers. And these are typically softer and they digest very easily. They can lead sometimes to like gas production and stuff like that, but it doesn't actually produce pain or gut inflammation in that sense. And so to give you two really good options for soluble and fermentable fibers, one would be steel cut oats, which is a great resource. A lot of people with Crohn's and ulcerative colitis have a hard time with grains, but steel cut oats is an exception. And it's a great carb that they can rely on, and something that will actually improve their microbiome over time because it's mainly soluble and fermentable fiber. Plus, it contains a variety of polyphenols and nutrients. It's a completely unrefined food, so you're getting all your vitamins and minerals from it. This is a food that, if relied on long-term, would be such a better option than what most people rely on, which is something like white rice, which they rely on it because they think it's safe. But again, that's very short-term thinking, because white rice is not going to improve your microbiome. It's a pure carb. It's devoid of vitamins, devoid of minerals, devoid of fiber. It's not going to give you any long-term benefits. So while it may help you with the current flare-up, white rice in this example, long-term, you're going to be chained to this vicious cycle because you're not improving anything long-term. If instead of relying on white rice, you rely on something like steel-cut oats, cooked well, mushy, that will absorb very easily, it'll digest easily, and it'll improve the microbiome over time. So that's a great food to rely on with a great source of fiber. A second option would be psyllium husk or psyllium husk, however you want to pronounce it. It has a bunch of research for both IBS and IBD at this point, and it's mainly soluble and fermentable fibers. It's usually tolerated very well. My only caution with psyllium husk would be to start small, like 5 grams, and increase it if you're doing okay with it. But don't start with 3 huge scoops and start with 30 grams or 40 grams right away, because that's just, your gut's not going to be used to that, and it could cause issues with that dose. So if you have been avoiding fiber because you've noticed it flares you up in the past, which is very common with Crohn's and ulcerative colitis sufferers, they just start avoiding fiber because they feel what it does to them. Just know that there's different types of fibers. Start playing around with the safe types of fibers. These are 2 great examples, psyllium husk and steel cut oats. And just start small, like 5 grams, do that for a week, increase it by 5 grams, do that for a week, and just assess the response. Over time, you want to try to increase it to about 30 to 40 grams a day of good fermentable fiber would be a great goal.
Sean, I have a question. What do you think about resistant starches? Now, I don't know too much about this. I only kind of messed around with it with some clients that were type 2 diabetic. And so I was using resistant starches within the context of that client case. But I know that they are somewhat like, it takes a while for the fermentation process to happen with the resistant starches. So it's not like an instant thing, it's more tapered. So is there any sort of use here with them? And because there's a whole bunch of different types. I think there are 3 types or whatever. But do you know anything about this?
Yeah, there's actually 4 types, but the 4th type is a synthetic form. Even though it's synthetic, it actually still works really well. Resistant maltodextrin is an example of the 4th type. But yeah, resistant starch is another safe option for Crohn's and ulcerative colitis because it is fermentable, which is what we were talking about. It's also soft, it's soluble, that type of thing. So you can use high maize resistant cornstarch as an example. You can use, there's one that I particularly use called Fiberzol 2, which is a brand name, which is actually a type 4 resistant starch. What I'll say about resistant starches is I would avoid, the type that I would avoid would be the retrograde type, which is where you cook and cool something. So you can cook potatoes and then you could put in the freezer or fridge and cool it and it'll turn into resistant starch. That tends not to go too well, not because of the resistant starch, but because of the other things that are hard to digest in the potatoes. For Crohn's, for example. Same thing with if you can do that with bread. You can toast bread and then put it in the freezer and it'll turn into resistant starch. At least some.
Oh shit!
Yeah.
Done deal.
But bread in general, bread and potatoes don't go well for Crohn's and ulcerative colitis in general. So turning them into a resistant starch still doesn't go well because of the other components that are in them. So, but something like high maize or the type 4 Fiberzol 2, those tend to work well because it's a pure starch. That's all you're getting. Now, the one caution I will say is, again, the resistant starches are great for inducing short chain fatty acid production in our gut because that's essentially what they do. They're resistant to our digestion. So our gut bacteria eats them and poops out the short chain fatty acids. However, a lot of that happens early in the colon. So it doesn't, sometimes the short chain fatty acid production doesn't reach the distal colon with resistant starches. And also you're not getting a whole food. You're getting just a pure a resistant starch is like a fiber. So you're getting like a pure fiber, which means you're not getting the polyphenols that always come with fiber. If you go throughout our entire evolutionary history, you cannot find fiber anywhere without polyphenols associated with them. And they interact together to help modulate the microbiome, which means if you consume a pure fiber and you have a very dysregulated microbiome, that fiber can feed whatever. And so that's when it can start to cause some problems. But if you start small with the fiber, and you get it from a whole food source like steel cut oats with all the polyphenols that are in it, those polyphenols actually help to modulate what can survive in that environment now. So it helps over time to help the good guys thrive and the bad guys not thrive as much. So for someone with a dysregulated microbiome, I think it's safer to start with whole food sources. And I consider both psyllium husk and steel cut oats to be whole food sources. However, if you're doing well and you're improving, you're in a good place, you can definitely try throwing in some resistant starch and seeing how it goes for you. There are like 2 or 3 clinical trials now that have shown benefits for IBD with resistant starch. And we have like 8 animal mouse studies that show great benefits with resistant starch for experimental IBD. But I would just have those cautions in there.
Thank you.
Do you guys have anything on that one? Like, that was a lot. I didn't know if you guys, Jason, you have a follow-up or anything before we move to the next one?
No, I'm good. We can move on. I think that was pretty
was
good.
tight. Yeah, no doubt. All right. Now, earlier we talked about fats and you were discussing all that and how they're properly absorbed. Let's get into some tactical tips. So we have omega-3s, which are becoming popular because of all the research out there, especially with some of the stuff on thyroid and all that. And most people know they're general anti-inflammatory, great for joint health and blood work and all the good stuff. But how do you recommend it and how does it fit in to treatment with IBD? And do you think it tends to be helpful?
Yeah, so the omega-3 stuff is actually tricky and there's nuance here that's very important because omega-3s are anti-inflammatory, and in all of the animal studies for IBD, omega-3s, fish oil in particular, gets great results. However, when you go to the clinical trials, the vast majority of the clinical trials that use fish oil show no results for IBD. Now, the question is, why is that the case and what can we do about it? And when you look deeper and you really look into the research, what it becomes obvious when you kind of compile it all together is that it's not just the omega-3s that are important, it's the ratio between the omega-3s and omega-6s that you're putting into your body on a daily basis. And if you are going out to restaurants, if you're eating chips, snack food, stuff like that, that's loaded with vegetable oil, which are omega-6s, which are pro-inflammatory, essentially the opposite of omega-3s. Most Americans, for example, consume dozens upon dozens of omega-6 each day unknowingly. And if you pop like 1 to 2 grams of omega-3 each day from fish oil, that's hardly going to bump that ratio at all. And this point was driven. Yeah, I mean, you're consuming, let's say, 70 grams of vegetable oils per day, and you consume 2 grams of omega-3s. That's not going to do a ton. But in one clinical trial with Crohn's disease, they put them on an experimental diet where they changed their habitual ratio of omega-6 to 3 intake to a 2-to-1 ratio, which is what most nutritionists will say is ideal. So that means 2 omega-6s for every 1 omega-3, which is much higher in omega-3 than we normally consume in westernized cultures. So that changes the ratio like crazy. And in that study, changing that ratio had great results. Now, importantly, they actually didn't use fish oil in that study. They used flaxseed oil to bump up the omega-3. And in the rodent studies that actually got the best results, they actually also used flaxseed oil. This is further confirmed by a study that just came out this year in 2022 for rheumatoid arthritis, another autoimmune condition, where flaxseed oil beat fish oil at equal dosages for reducing symptoms as well. This flies in the face of most people's thinking because we've been taught that it's fish oil that's responsible. It's the EPAs and DHA that's responsible for the anti-inflammatory action because those are the guys that actually produce the prostaglandins. And if you take flaxseed oil, we're taught it has to be converted to fish oil kind of in our body first before it can have any beneficial effect. And that conversion is low. So just skip the flaxseed oil and go to fish oil. However, with fatty acids, there's a whole emerging kind of science in it where we're finding out that it's not just the prostaglandins that are responsible for these anti-inflammatory effects. There's something called oxylipins. These are oxidized metabolites that are produced from both flaxseed oil and fish oil. the type of fat that's in flaxseed oil produces its own independent anti-inflammatory oxylipins that fish oil cannot produce. So this is when you start to have it starts to get a little more nuanced and have different effects. And in all of the research we have right now, it's showing that flaxseed oil is actually beating fish oil for autoimmune conditions in general. This is the case for rheumatoid arthritis. It seems to be the case for psoriasis, Jeffrey. And for multiple sclerosis, we've actually known that for over a decade.
Really, for MS for over a decade?
Yep. Probably 2 decades at this point, to be honest. But in that, just through experimental results, because people with MS that take fish oil tend not to get much benefit, but the trials where they use flaxseed oil, they notice a significant response. So the benefit of flaxseed oil as well, or ground flaxseed, because in the studies where they use ground flaxseed, it got equivalent results to flaxseed oil, and ground flaxseed is dirt cheap. The important point with flaxseed oil is you don't have to keep it at the same dose as fish oil. Fish oil becomes unsafe if you were to get up to like 10 to 12 grams a day of it. Whereas that's not the case with flaxseed oil. You can take 15, 20 grams of flaxseed oil and be completely safe in terms of blood clotting, cardiovascular issues, things like that.
Hey, Sean, why do you say that fish oil around 12 grams has toxicity? I know Charles Poliquin was big in like 30 grams a day. Like, he thought it was amazing. What research are you relying on, or where are you getting that figure?
Yeah, so when they took studies with high dose fish oil and they looked at cardiovascular outcomes long term, when you get to really high dose fish oil, the benefit is either lost or it can even be reversed. Not saying it's detrimental, but it doesn't have that same cardiovascular benefit we're hoping it does. The reason why that is because out of every single type of fat you could possibly put in your body, fish oil is the most prone to be oxidized and thus induce oxidative stress, because it's the longest chain and has the most amount of double bonds, which means it's the highest probability to be oxidized. And a lot of it is oxidized in our body. Sometimes you can even buy fish oil caps. If they're not a good brand, they can be semi-rancid by the time you consume them.
Yeah.
So if you are going to do high dose fish oil, that's the first thing you want to do, is make sure you're getting a really good brand. In my opinion, I don't supplement with fish oil personally. I don't see a benefit to it when there's an option like flaxseed oil. And if you want another little hack, there's a line of research showing that if you want to take curcumin as a supplement, it actually greatly elevates the enzymes in our liver that convert the flaxseed oil fatty acid to the fish oil fatty acids. And actually helps to transport that to the brain, which is great for anxiety and stress and neurodevelopment as well. So what I personally do is actually take a combo of curcumin and flaxseed oil. But as far as IBD goes, all mechanisms aside, the experimental research we have at this point clearly points towards flaxseed oil being more beneficial. And you can also take more of it and don't have to worry about anything. So if you take, 10, 20 grams of flaxseed oil, and at the same time, you're decreasing your omega-6 intake, meaning you're going out to eat at restaurants less because they always cook with vegetable oils. It's the cheapest. Chips, other snack foods, TV dinner, stuff like that. You decrease that intake of the soybean oil, the corn oil, safflower, sunflower, all that stuff, and you increase your flaxseed oil intake, or just ground flax seeds, that you have a major change in your omega-6 to 3 ratio in that case, which is fantastic, because there's separate lines of evidence showing that just reducing the omega-6 intake has benefits for IBD, and just supplementing with flaxseed oil has significant effects on IBD. So when you combine them, you kind of get that synergistic effect too.
Pretty badass and tight, man. The next one I wanted to touch on. So this is kind of probably like a 2-in-1. What's the one simple overall diet strategy you often recommend with IBD? And you said you wanted to make sure you touch on polyphenols and the short-term and long-term thinking. But you also, let's be honest, isn't everybody doing low FODMAP with this? And what is your thoughts on low FODMAP with IBD? Because we're going to be talking about a diet strategy. Do you deploy that? What are some of the stuff you recommend in the short term versus long term thinking?
Yeah. So the overall diet strategy, I've kind of like talked around it at this point, but what it is when people who have IBD are in a flare up or have repeated flare ups or don't know what to do, they end up having major dietary restrictions, and that's not even applied to them. They do it voluntarily because they know that if they eat certain things, it's going to make it way worse through experience. And that's almost universally the case. And so what ends up happening, and this is something I've seen over and over, is they stay on these restrictions long term. And this is what paradoxically never allows them to get out of that cycle. They always are worried about the next flare up, but what they're doing is promoting the next flare up. And what I mean by that is going back to that white rice versus steel cut oats example. If you restrict your diet, and it's not even white rice, like if you go to a hospital or medical doctor, sometimes they'll put you on this formula liquid diet for long term as well, which it gives your gut a break to get out of the current flare up, but it does absolutely nothing to improve the microbiome and help you not get into another flare up. So what tends to happen is as soon as they get off that liquid diet, they'll feel good for a month or so, and then things will start getting bad again. And so that's not an effective long-term strategy. Sometimes that type of stuff is necessary for short-term, but as soon as you can break free from that and start incorporating completely unrefined foods, and steel cut oats is a great example. Very safe fruits are a great example. I'll give you an example: papaya, bananas, things like that tend to work really well for IBD. As far as diet options go, there's a type of diet called IBD AID. It stands for anti-inflammatory diet. That was produced by medical school, and it gives you a list of foods from phase 1, phase 2, phase 3, meaning current flare-up, intermediate symptoms, and remission, of foods that tend to be safe. And those foods they follow all of the rules we've been going over this point in terms of the types of fiber and all this stuff. So if anyone listening wants to look up the IBD-A diet, it's a fantastic resource to know which unrefined and whole foods that will benefit you and improve your microbiome over time and help you actually get out of the cycles that you can rely on, instead of relying on refined foods or formula or liquid diet that will tend to keep you chained to recurring bouts of flare-ups and damage. Now, piggybacking off of that with the low FODMAP, this is something that actually is really important because a lot of people with IBD, unfortunately, attempt a low FODMAP diet pretty early on because it's kind of all the rage right now. And low FODMAP was not designed for IBD. It was designed for IBS. And this is why I said in the beginning, you have to treat these things differently. Low FODMAP does not have experimental research to support that it improves IBD over time compared to any other type of diet. In fact, when there was one study that compared a low FODMAP diet to a Mediterranean diet for Crohn's and ulcerative colitis patients, and the Mediterranean diet got better results. And that's not even taking into account the specifics of like the good fiber versus bad fiber and certain foods to avoid and stuff like that. The reason why it's important, in my opinion, not to try a low FODMAP diet, at least in the beginning, I would much prefer the IBD AID diet because that was designed for IBD. The low FODMAP diet restricts essentially fiber, is the way to think about it. All of the FODMAPs are these short chain carbs, but they resist our digestion. So in that way, they act exactly like fiber. So what the studies have shown is that even in normal, healthy individuals that go on a low FODMAP diet just because they have some gut issues, over time, their gut microbiome actually tends to worsen. There's not been a single study that has showed that the low FODMAP diet improves the microbiome. About 80% of the studies show it worsens the microbiome. And the other 20%, the reason it didn't worsen the microbiome is because other things were put into play, like probiotics, for example, that helped the microbiome kind of stay like it was, not get worse. So the low FODMAP diet is extremely limiting. It's very tough to go through. You have to do it very methodically. And it's something that kind of, again, keeps people chained away from certain foods. The truth is, with Crohn's and ulcerative colitis, the foods you're sensitive to in a flare-up are not going to be the same foods you're sensitive to when you're in remission or when you get out of your flare-up. So if you do a low FODMAP thing and you find out, hey, I can't consume fructose at all, but you might have done that while you were in a flare-up. If you're in remission, you might be unnecessarily avoiding fruits that could actually benefit your microbiome over time. So again, the low FODMAP diet, great for IBS. Again, there are some things to consider when using it, but for IBD, it's not a go-to in my opinion.
I have a question, John.
Yeah, go.
All right. So it's clear that, IBD, like, psoriasis or like any autoimmune disease, is something that you must manage for the rest of your life, right? So without looking up this IBD-A diet, because I know a lot of our listeners aren't going to do that. So my first question is, could you rattle off maybe 3 or 4 sources of proteins, carbs, and fats that you might implement in a diet for a client or patient with IBD? And then my other question is, I don't think we talked about testing. So if somebody suspects that they have IBD, it's probably not a GI map or a blood test that can test for that. So what should they do to confirm the diagnosis first, and then give us some diet tips? If you
Good question. And I got the last one to wrap her up.
Okay, so to confirm it, you do need a colonoscopy. There's no other way to confirm Crohn's or ulcerative colitis besides a colonoscopy.
Yeah.
Now, the difference between Crohn's and ulcerative colitis is that Crohn's is actually a full GI tract issue, or at least potentially. That means it could be anywhere from the rectum all the way to the mouth or lips. Actually, a lot of people who have Crohn's end up developing lip sores and mouth sores. Sometimes they think it's an allergic reaction or herpes or something like that, but it's actually Crohn's. And it could be, you can have esophagus inflammation, which can cause acid reflux. It could be in the small intestine. It could be anywhere. So usually most of it is the colon for Crohn's, but it can be the whole GI tract. Now for Crohn's, the signature finding that almost needs, it's kind of pathognomonic, which means if you find this, you have Crohn's, which means if they do a colonoscopy, if they find skip lesions, then you have Crohn's. And that means that there is damaged tissue in the colon separated by healthy tissue, separated by damaged tissue, and it skips like that. And in those damaged tissue layers, it's going to be all 3 mucosal layers. It's the entire mucosa. That's Crohn's, entire mucosa with skip lesions. And that's found with a colonoscopy. With ulcerative colitis, it's more or less continuous inflammation. You do not see those skip lesions. And ulcerative colitis is only contained to the colon. It doesn't affect the rest of the GI tract. It can't go to the mouth, for example. And it's contained within the innermost mucosal layer. So with ulcerative colitis, it does not affect all 3 layers. It only affects the innermost mucosal layer. These things are easily picked up on a colonoscopy, and any good medical doctor should be able to distinguish which one they're looking at. Now, at the same time, if you do see these findings in the colon, they should come along with certain markers in the blood as well, like high C-reactive protein or high ESR, just these general inflammatory markers. Usually in standard lab tests, they don't go further than that. But if you went to someone more specialized, you might see increased interleukin 17, interleukin 1 beta, and TNF tumor necrosis factor would all be increases as well. But for the vast majority of the time, you're just going to get a colonoscopy, and that's how they're going to diagnose you. Now, as far as food suggestions, for proteins, the worst protein to consume, and again, this is not for everyone because I love red meat, but it's red meat. Unfortunately, red meat does not go well with Crohn's and ulcerative colitis. And the reason seems to be is it's actually the heme that's in the meat, which contains this iron, that when it goes down to the colon, if there's existing oxidative stress in the colon, that iron actually promotes that. And so regardless, again, of the mechanism, the experimental evidence is really clear at this point that red meat, it gives the worst results for IBD. Something like chicken, turkey, just leaner white meats, fish, for example, will all tend to do better than red meat. Even dairy will be better than red meat. The only consideration with dairy is actually not an allergy for IBD. Again, we're not talking about IBS, but for IBD, dairy is usually an issue only because of the lactose. So if you get lactose-free milk, or you take lactase enzymes, usually you do completely fine with dairy. Most people unnecessarily restrict dairy because they've drank a glass of milk and they got diarrhea an hour later. But if they were to take lactose-free milk, which they probably never tried, they would be fine. And so that would be at least something to try. So and eggs are typically okay for protein as well. So that would be the protein thing. For fats, we've already gone over flaxseed oil. Major fat to avoid, again, are the vegetable oils. By far, there's no comparison to that. Second to avoid would be long chain saturated fats. And this means butter and animal fats are long chain saturated fats. Again, for Crohn's and IBD, it just doesn't go well. Short chain or medium chain saturated fats actually go very well for Crohn's and ulcerative colitis because they're not absorbed in the colon. They're absorbed in the stomach and small intestine. So you can take MCT oil, you can take unrefined coconut oil. Both of those will work really well compared to like butter and animal fats, for example. And then you want to choose something like olive oil compared to canola oil. Both olive oil and canola oil are mainly monounsaturated fats, which means they have the same fatty acid profile for the most part. They're very similar. But extra virgin olive oil, especially if you get a good brand, it has all of these anti-inflammatory polyphenols. So we've already talked about how they help modulate the microbiome in a positive way. Canola oil doesn't. It's completely refined, like ultra refined. And again, regardless of mechanisms, there was one clinical trial that lasted 1 month long for Crohn's disease patients, where the only difference in their diets was one used extra virgin olive oil in all their meals, and the other one used canola oil. Every single patient in the canola oil, their symptoms got worse and their inflammatory markers increased. In the olive oil group, everything got a little bit better. So so take home point is coconut oil or olive oil to cook with. You can take flaxseed oil as a supplement if you want to, and avoid the other saturated fats and the vegetable oils. And the vegetable oils are in everything. So you're really gonna have to look at nutrition labels for that one.
Yeah. What about carbs?
So for carbs, like I said before, the best grain to consume would be the steel cut oats. Rolled oats could be okay as well. If you're really in a flare up though, the steel cut oats, if you make them really mushy, they work better. The most important thing to know for carbs is the texture is very important. Again, this is specific for IBD. This doesn't make sense to anyone else. Like if you're a normal person, this isn't for you, but if you're in a flare up and you're not being able to tolerate certain foods, if you puree them or make them very mushy or cook them very well, you'll be able to handle them a lot better. You don't have to do that forever, but to get out of the flare up, that would be a great thing to do. Most fruits tend to be okay, but again, papaya, bananas, and apples can work well, but with apples, a lot of times you end up having to peel the skin. There's something in the skin that does not tolerate well with Crohn's and ulcerative colitis patients. I would avoid during a flare-up all other grains, wheat and corn and all that other stuff.
No cream of rice, huh?
What's that?
No cream of rice. No potato.
No cream of rice. No. And also avoid during a flare-up things like beans and nuts, because even though they're helpful for your microbiome long term, that's not the time when you're going to be able to tolerate them.
Got it.
So those are some general suggestions. Again, outside of that, you kind of have to see what works for you in terms of the carbohydrate intake. The best rule of thumb though is mushy, like pureed mushy. If you're in a flare up and you're struggling, just try to cook things well and make the texture very soft. Again, I can't remember off the top of my head all the other carbs, but if you do look up the IBD aid diet, that's a clear list where they break it up into sections. They breaks down tons of different food choices. So it's a good reference to go to.
Awesome. That was a very, very helpful answer. I'm sure our listeners will fucking love that. So thank you, Sean.
Dude, this whole thing's been fucking gold. I'm like just sitting here like share the shit out of this.
There's so much application here.
I know. That's why I like having Sean on. Sean gives you the damn application to take home and win.
Brilliant.
Sean, last question. Well, I actually got another one, but it's mostly about books. Chronic stress, we know it impacts the immune system. It causes nightmares for people with IBD. It can increase their symptoms, throw them out of remission. I know last night we talked about the emotional freedom technique when we were talking about various things, and you talked about that with our the listeners on the IG Live. But what are some stuff that people can do to like who have IBD, who could get to help lower their stress, get them more relaxed, so that way they can live a better, more efficient life on a day-to-day basis?
Yeah, so anyone with IBD is going to eventually realize how important stress is. It's something that they don't need to be taught. It's something they know from experience. When they go through their different flare-ups, they can clearly link it to stress. Almost everyone can. So most people are aware of this, but they have no idea how to reduce their stress because they weren't really taught any good techniques. Now, in terms of the research, what we have the most research for is actually hypnotherapy, to be honest. If you go on PubMed and type in hypnotherapy and inflammatory bowel disease, there are dozens of clinical trials that every single one of them shows very significant effects. And again, it's just a technique that kind of helps the subconscious mind relax a little bit. That's something that you'd have to see a practitioner for, though, which it's not in my course actually for that reason, because my course is a self-help course. So what I use instead, and also has mounting data to support it for autoimmune conditions, is that emotional freedom technique. It's, again, like we said yesterday at the Instagram Live, it's something that looks strange. I know because of that, it's not going to be for everyone. Not everyone's going to be willing to try it. If you don't want to try it, I would try other things like meditation, just, taking some time out, going for a walk, deep breathing, just the general stuff, getting your sleep right, all of that stuff. But as far as kind of the biggest bang for your buck for self-help treatment, it's the best thing that I found. And essentially what it does is we know that we have certain recurring thoughts and recurring emotions that come up for us, and we feel like we can't get them under control sometimes. If we could just instantly reduce our anxiety on our own, but we can't. Sometimes we feel we don't have control of that internal dialogue. There's many different applications of how to use emotional freedom technique. There is a best way, in my opinion, and it's the way that's been used in the clinical trials. However, that takes some studying and learning, to be honest, on how to use that. For a more general approach that can still be effective, if you simply just tap on these acupressure points, and I know this is an audio, so they can't see my face, but
oh no, we're on YouTube now, sir. They can see your face. Yes, sir.
Okay, cool. So if you tap on these meridian points, there's one in between each part of the eyebrow here, one on the side of the eye, on the bone under the eye, in between nose and lip, in between lip and chin, right on your either side of your sternum here in the upper sternum, and then last one underneath the armpit, right about nipple level. Again, what those points are they're the beginnings of the meridian system. So each one of those is a different meridian line that comes from ancient Chinese medicine. It doesn't matter if you believe in meridian systems or not, because we have functional MRI studies now showing that just by simply tapping through these points, it starts to calm down the amygdala of our brain, which is part of the limbic system that's responsible for the fight or flight response, the stress response, that type of thing. So what I tell patients to do as the simplest way of doing this is imagine you are venting to someone, like trying to get something off your chest. You're calling a friend, you're venting. I'm sure some of us have had some experience where you vent to someone and you feel better afterwards because you didn't suppress your emotions, you kind of let them out. But that's
Jason
not
yells
always
at me all the time.
But that's not always the case. Sometimes we vent and we get caught up in our story, and we just continue to be stressed out by it. Yeah. So what the research is pointing to is if you do the same thing, just vent, talk to someone, talk to yourself, whatever you want to do, but at the same time, just tap on these points. And if you're listening to this as an audio, if you search Google EFT points, tons of options will come up you can look at, and go through a 10 to 20 minute period of what you're stressed out about, putting it out there. Don't bury it, kind of release it, vocalize it, and tap through the points. And what you'll find is if you were like an 8 out of 10 stress level when you were starting, you might drop down to a 4, a 3, sometimes even a 0 at the end of a 10 to 20 minute session. Now, again, this isn't the most powerful way of using EFT, but it's the simplest way, and a way that everyone could start implementing right now. What I recommend is don't believe it, just try it. You don't have anything to lose. It's free. What I would not recommend though is going up on YouTube and looking up tapping scripts and following along with that, because that's been shown to be the worst form of applying EFT, because it's not your own words. It's not what you're stressed about. It's kind of the most watered down way of using EFT. So again, easiest way, learn the points, just tap through them. You'll learn them in 1 minute. And just vent for walk around the block or go in your backyard or something, maybe where people can't see you, and tap through the points as you're getting everything that you're worried about out there. And it'll tend to help a lot more than just a regular venting session.
Right. Dude, he went over that last night and someone messaged me and was like, that was a game changer. They had a therapist who went through it, and they were really shocked that you were aware of it. So that's a cool one, guys. Be sure to listen to his resource and go dig on it. It's really cool. Last question. It's a +1. I have my Amazon pulled up, and as you know, I'm Book Daddy. What are some good books that we can get that you might recommend outside your course? Maybe for listeners of Gym Pop to maybe get more familiar, or maybe some coaches to kind of begin their dive of familiarity before they were to sign up for your course so they could get more familiar. Is there any good resources you have?
Yeah, to be honest, I've read through probably 3 different Crohn's and ulcerative colitis books, and I'm not thrilled about any of them, to be honest.
This answer, I love it.
The one that I would probably, if you want a book, I'd probably just say the original, Ending the Vicious Cycle, which involves the specific carbohydrate diet, would be a good resource to have. That has helped, thousands to maybe millions of people at this point with IBD. However, the IBD aid diet that I've been talking about is an evolution of the specific carbohydrate diet. So the specific carbohydrate diet came out in the early 1900s. It's been evolving since then. And then this medical school, UMass Medical School, came out with this IBD aid diet that essentially combined the current modern day research that we know about the microbiome now with the practical application that they've been experiencing for years with the specific carbohydrate diet. And they kind of tied them together to give you kind of the best of both worlds. So, but again, if you just want a book that will kind of help you, the Ending the Vicious Cycle is a good reference. Sweet.
No, thank you. I mean, I always like little stuff like that because some of us are all different learners, and I love books. So anyway, thanks, Sean. Where can everybody find you? I know that your course you talked about, you even told me to remind you that there's a free gift for our listeners. So if you want to go ahead and tell them where to find you on YouTube, your course, Instagram, all that good stuff, man, because this was a great episode. Thank you for coming on and doing this with us.
Yeah, of course. I always love being here with you guys. So you can find me at goldenhealthmethod.com. All of my handles are Golden Health Method. So that mainly that's Instagram and YouTube. So you can find me there. I kind of post different things at different places. Right now, my ulcerative colitis and Crohn's course is my only course I have out right now. It came out a little over a month ago at this point, pretty brand new. To be honest, even though, we went through a lot of different strategies in this, there's a lot that we didn't cover still. And so, there's still a lot packed into that course. That course took me over 2 years to build. So I want it to be the most powerful
Holy
reference.
shit.
Yeah. I want it to be the most powerful reference that anyone with IBD could have to help themselves. So, I would encourage you to check it out. I do have a free gift, which is a free mini course for IBD. Completely free. If you want to go to goldenhealthmethod.com/gift, you can find that there. And you can go through that mini course before you decide if you want to go to the big course or not. But even that mini course will give you a lot of practical suggestions that can help you.
What was that address again?
goldenhealthmethod.com/gift. And that should be live in about a day or two. I just have to do a redirect for that. But
okay.
In a couple of days, that'll be live.
John, if I want to take your class, how do I sign up for that?
So you can just go to goldenhealthmethod.com. You'll see at the top, it'll say courses.
Oh yeah.
Click that and you'll see the courses. The main website for my courses is goldenhealthmethod.thinkific.com. But again, if you go to either my Instagram, my YouTube, or my website and click on any video or my bio on my Instagram, it's in the descriptions, it's in my bio, it's kind of everywhere. So you should be able to find it that way.
But how long is it, just for our listeners? How long is it? How much does it cost? If you can share that.
So it costs $500 at this point, and that price will honestly be increasing throughout probably at some point this year. It's kind of an early bird discount, but it's 50 modules.
Wow.
And each module is at least 20 minutes, sometimes going to 45 minutes.
50 modules?
50 modules, yeah.
40 minutes a piece?
20 to 45.
20 to 45, yeah.
For only $500?
Yeah. That's why I said it
in that class.
That's why I said it's going to go up.
I'm getting that class.
Do you teach it live, or is it actually like recorded out and it's modulated out? Correct.
It's all pre-recorded,
okay,
and I wanted to do that because it comes with video and PDF documents. The video is very practical. So the video says what to do and why to do it, so that everyone can understand it. The PDF documents are very in-depth and go into the science and the research more, literally listing out every single citation and everything that I got this from. So there's no issues with trusting the information. You can check all of it out yourself. And most importantly, for those with IBD, you can take those PDFs to your medical doctor and show them the clinical trials, like with a particular supplement, for example, if they are uncomfortable with putting you on that supplement because they probably don't know of these trials. So you can show them, hey, for this supplement, there's been 10 clinical trials and they all got great results. Can I try this? And that would help you kind of advocate for yourself.
Sweet. Sean, I'm buying your class. I'll see you guys in there. That's ridiculous, man. That's really cool. Well, dude, thanks for always coming to join us. I know me and you were chatting about doing another one here in a couple of months. So let's get a topic. And I know you're working on a master class for hypothyroidism. So I can't wait. I'm going to push you though. I expect at least 75 modules at 50 minutes. But always, dude, thank you for joining us. And it was a great time. And be sure to share this episode, guys. If you're a coach, even if you're just a listener, this is full of gold. So thanks again, Sean.
Thank you, Sean.
Yeah, thanks for having me here. I appreciate it, guys.
Awesome.